People have to drive to whole other counties to get the care that they need because
Right.
it's low resourced out here, you
But do
know.
you think also, like just with doctor training in general, or training for nurses, that that needs to be a part of the training? What's happening with maternal mortality, culturally competent, that's not my favorite word, care, like those kind of things too. It just seems like something needs to be different as we're training doctors and nurses also. And then also, who else do we go to in the community to be the trusted messengers to let them
Right.
know that, you don't have to go to a hospital. I mean, you need partners and allies and help, and getting the word out.
Mhm. Absolutely. And that's
Yeah.
why doulas and other sorts of maternal health experts is really important because they can be on the ground and on the front lines telling people about their options, getting people enrolled in community childbirth education classes and teaching people about how birth actually works so that you don't have to, be coerced into having interventions if you don't want certain medications or procedures done without your express consent, And so I think having more people involved on the ground, especially doulas and other birth workers and community health workers who are willing to discuss these issues and talk to the public because the hospital's not going to do that. They're interested in their bottom line and getting people in the door, but they're not going to have the time or the infrastructure to provide that education.
Right. So let's also talk about the fact of like integration of midwives. So there's been data that's been proven for several studies that shows that when there is an integration of midwives within a system, then there's better outcomes. So right now we have like a group of people that are essentially pushing the Western medical model and a group of people that are pushing the community-based setting. Right now, there isn't any type of collaboration going on. So we can somehow facilitate that. That would be really helpful, especially because in Illinois, we are a new emerging industry in terms of CPMs. I need to be able to collaborate with somebody in the hospital, you know what I mean? And in terms of being able to bring down, to reduce, quote unquote, the bottom line for the hospitals, it's been proven that the CPM model is really is preventative in itself in terms of having better outcomes. So essentially, if we prevent a child from being admitted into an infant from being admitted into the NICU, we essentially save that hospital over almost $300,000 per infant. So think about the preventative value that you have within one CPM. It's a lot. It's a lot of money.
Wow.
So,
And that, to that question about, what's the learning and the education that those, the doctors, the nurses, those, those medical professionals should be having, it really should be an integrative learning. And what I mean by that is how to work with other medical and healthcare professionals, because within the medical industrial complex, it's very much a hierarchy, which is like that pyramid, but we need much more of a collective collaborative. And when people are talking, which is like a round table. So when people are talking about, patient-centered care really look like healthcare providers from multidiscipline working together. And that is not something that just happens because of how that hierarchy has been for so long. That is something that needs to be learned and educated, from working with your obstetrician, to working with your midwives, to your naturopaths, to your chiros, to your Reiki practitioners, to your doulas. We could go on and on, but all of those people should really be seen as having a value add to the laboring or to the birthing person. And also, I wanted to just bring up about the whole community-based model. What I have found, I was a community-based doula for 5 or 6 years. I've been a doula for 11 years. Is that in a lot of those community-based models that have state funding or federal funding, the eligibility criteria is very narrow. Once you get to be 21 years old, 24 years old, because the funding is for youth development, and that, by the letter of the law will stop, in the early 20s, then you're leaving out a whole gambit of folks that do not have access to community-based resources that can be the gatekeepers to give that education as to, these are what your options are. This is safe, or these are the kind of parameters that can make it safe, and all those sort of things. So I think that those two components would at least go to push us in the right direction.
And maybe even having some type of legal structure that would support the collaboration, because as you guys may have known, there was a recent case that spiked in Texas with a family that chose to birth outside of the hospital, and essentially, them trying to quote unquote collaborate with a pediatrician. led to medical, just them kidnapping their child. This is making people that are working outside of the system afraid to collaborate with people in the system, because we run with things like this. This is why people choose to quote unquote birth unassisted. It's happening all the time. And this is a narrative that goes amongst, that's talked about, that's pushed amongst out of hospital community providers. We talk about it all the time. You know, we're afraid that if we collaborate, then they're going to quote unquote, because they have a perception of the type of care that we're providing. And I agree with Mai saying that, yeah, maybe we should be coming to the table and then them really having an understanding of the model of care that we provide, especially because we are legal in this state. I think it would help to deter a lot of this policing. I like to say the word policing in our community. Okay. Yeah.
So you've given me a challenge, but in thinking about what you've shared, but what other policies or information would you want policymakers to know? I know, Star, you've had some successes, you know, on the state level, but even on the federal level, you know, we're pushing and pushing. We, you know, with the postpartum care, we were successful, not, you know, the whole United States, but state by state, it seems like they're coming around. We hear that Mississippi and Oklahoma might be the next states that will cover for a year, you know, postpartum care. And we're very interested in diversifying the healthcare pipeline. We're interested in diversifying even clinical trials with pregnant moms and moms, because our clinical trials are not diverse enough. And if you're trying to, you know, if a group has a certain ailment or disease, you would think you would use more people, you know, from that group, and not what has been happening. So there are things we've been successful in, but, you know, we're still fighting, you know, to get the bills passed. But what are some things you would want my colleagues to know about this issue?
I think really just enabling more birthing people to receive care in community birth settings should be like a top priority right now for anybody, whether it's local, state, or federal levels. I mean, congruent care, it's been proven that if you have congruent care from somebody that looks like you, that comes from your community, that understands the plight of being Black in America, especially a woman, because only we know what it's like to be a woman in 2023 to walk right now, right? So in order to have like that safety of someone that kind of understands, they know better how to take care of you. And like I said, we have the data to support everything. I just feel like people aren't ready for us, but we're here, and they need to start integrating us into the system, because we as Black women are demanding it in astonishing numbers. We just need people to catch up with us, you know?
Right.
Quick as possible.
It's hard to make changes, to think outside the box, or think differently, or
no, but people are open. People are open to it. COVID really opened a lot of people's eyes. We had people flooding in trying to get home births because people were thinking outside of the box. And it's just that number has continually grown. It's an uptick. It's going higher and higher and higher, because our people are recognizing, like I was saying, there's a lot of cracks within our maternal healthcare system in the States. You know, people are just like, they're tired. They're tired. And honestly, majority of births are not high risk, right? So we think about this. So why are the majority of our options are in a hospital setting? Shouldn't we be putting most of our investment in out of hospital community-based settings if we're having better outcomes? People want to have a community-based setting birth. And we know that the data that's coming out of the hospitals isn't favorable in terms of us. Like, it's literally killing us. So the logical reasoning would be to invest in community-based settings. You know? Okay. Yeah.
Isis or Dr. Heath?
Yeah, I think, you know, as much as, you know, I trust and believe in science, I also know that the evidence is not something that is reviewed on a year-to-year basis. And I think that changes in childbirth are moving faster than maybe providers can keep up, you know? And so I think practicing evidence-based birth, you know, evidence-based obstetrics, evidence-based midwifery, being current on the latest research and what is truly necessary in terms of standard of care. And, you know, yeah, I could say a lot, but I think that so many people should also just think about, what does informed refusal look like? What does shared decision-making look like? And I'm talking about consumers and providers, you know. I want people to reimagine what is truly necessary when it comes to giving birth, because a lot of the difficulties that we see are created, you know, they're human made, they're iatrogenic, you know, so they wouldn't exist unless we are trying to manipulate normal physiological birth. And so I think it's time to review our standards of care and what we've considered to be best practices. And I know for a fact that mothers and activists have been on the front lines of changing things that were, you know, routine, like episiotomies, but we're like, oh, we shouldn't actually do that anymore, or delayed cord clamping. Like we've known for years, like the
Right.
the grand midwives have known for years, don't mess with the cord, you know, until it's white. But yet science has, you know, had to come in and prove that that's a thing, right? And so I think it's just really important to respect people's birthing traditions and to consider that what we're currently doing may not be the best approach.
Let me let Dr. Heath, you have about 30 seconds,
Oh,
maybe a
okay.
minute.
Okay, well, I'll just lift again in this time that access to options and access to things that promote joy within our community. We can look even at our mental health numbers for folks that look like us, and there is way room for improvement there. You know, and in you had asked earlier about birth centers. I could run those down, what's available in the city. But even when you're going to various birth locations, unless you're at home, right, there are so many discrepancies and disparage, you know, just differences from one hospital to the other. When if someone goes one place, they can get nitrous, they can have these options. If they go someplace, then they don't have other options. So I would like to see more standardization, you know, among the options that birthing people have, you know, at those locations, and access to things, like I said, that bring joy and that bring experiences that people can have. You know, not everybody has access to a mother's help or a postpartum doula or something like that, or naturopathic care. So just access to more options so that people can make an informed decision about the experiences that they cultivate for their life. And we know that when that happens, that can help set up a healthy foundation, positive regard. And those are protective factors, you know, that protect against ACEs and, you know, adverse childhood experiences, and will hopefully promote peace among all of our communities.
Yes.
Thank you guys so much. This was short and sweet, but very, very informative. And please keep on doing what you're doing, because we absolutely need you and we're here for you also. So do not hesitate. Call us anytime. Our door is always open.
Thank you.
Thank you guys.